Well, good afternoon, everyone. I want to thank you for joining us for this UK Work Life Elder Care Services webinar here today. We're fortunate to have Kelly Parsons with the UK Sanders Brown Center to present on this topic of safety and dementia. I have previewed the slides, and Kelly has done a fabulous job of providing lots of resources, so we will be sending that out. The PowerPoint will be going out after we complete the webinar here today, so you'll get all those great resources. And for now, I'm going to turn it over to Kelly to go ahead and get started. Kelly, welcome.
Hi, thanks, Hazel, so much for having me. As Hazel said, my name is Kelly Parsons. I'm a social worker at Sanders Brown Center on Aging. We provide support to people who are involved in observational and clinical trial studies, and those affected by Alzheimer's disease and other types of dementia. So for this webinar, I'm going to start by reviewing some definitions, then move into how we clinically assess for memory and thinking deficits. And then the bulk of the presentation, as the title shows, is going to be how safety and dementia go together, how dementia affects safety, and some things that you can proactively do and sometimes reactively as well. So I'm just going to turn off my video and we'll get going. All right. Okay, so in regards to definitions, you hear a lot of different things being said, and sometimes I just like to take a moment and make sure everybody's on the same page. So cognition is a complex group of mental processes that include memory, attention, reasoning, language, and decision making. You all have might heard specifically because the FDA did approve a new infusion medication for Alzheimer's disease. You might have heard in and around your loved one might have been diagnosed with mild cognitive impairment. We also call it MCI. So, mild cognitive impairment is a medical diagnosis, and it's really kind of that in between no man's land of typical and normal thinking skills and a diagnosis of dementia. So, the condition cause of mild cognitive impairment causes memory loss and trouble with language and judgment, but it doesn't affect daily activities. So they may be aware that something is wrong and that their mental abilities have changed. Some may not be aware of that their mental memory and thinking has declined. This is actually a medical condition called anoskia. I tried to practice that, but it is a medical condition. Family and close friends might notice changes, but again, these changes are not bad enough to impact daily life or affect usual activities. It can show up as people needing longer to process maybe conversations that they've had, things that they want to say. It may take them a little bit longer to remember somebody's names. They might use more lists and reminders. But overall, a person with MCI can continue to live throughout the day normally. MCI does raise the risk of developing dementia caused by Alzheimer's disease or other brain conditions like vascular dementia. But some people with mild cognitive impairment symptoms might never get worse or better and just stay the same. And I'll talk about dementia in the next slide as well, but dementia is not a specific disease. It's a group of conditions that's characterized by declining brain function or cognitive impairment. And Alzheimer's disease is associated with initial memory loss, followed by impairments in cognition and functioning. There's different areas of cognition that affects Alzheimer's disease. This can be language, visuospatial skills, so seeing, executive functioning, so kind of our frontal lobe, coupled with behavioral changes. And amyloid plaques and tau tangles are the cause of cell death and tissue loss in Alzheimer's disease. So let's just talk about dementia because I think this is the biggest question that I get. What's the difference between Alzheimer's disease and dementia? Being from Kentucky, I like to say in Kentucky, not all bourbon is whiskey, but all whiskey is bourbon. Kind of the same thing for dementia. Alzheimer's disease is dementia, but not all dementia is Alzheimer's disease. So really, dementia is an umbrella term that describes the collection of symptoms. Alzheimer's disease is the most common form of dementia that we see at 40 to 70%. The second most common form is vascular dementia. So you think about strokes, blood pressure, things that have to do um, with our blood vessels. And then Lewy body dementia and frontal temporal lobe that used to be called Pick's disease. But that's a type of dementia, the frontal temporal, that only affects the front part of our brain. So where our executive functioning is held. So, how can we tell if somebody has dementia or if your loved one has dementia or maybe has mild cognitive impairment or you've just noticed some things? What are some things that you can advocate for yourself or your loved one? So, there are two types of memory and thinking tests that are very, very common that can be used in your primary care physician's office. Um, the two most common, again, are called the Montreal Cognitive Assessment, and that's this one right here. They also call it the MoCA for short. If you hear somebody say, oh, they got a score of 25 on the MoCA, this is the test that they have done. There's also the Mini Mental Status Exam, which is this test over here. And the Mini Mental Status Exam, or the MMSE, is the most common short test for a clinical diagnosis of memory or thinking impairment. So, based on these scores, and the reason I want to talk about it is there are some parameters in place based on a score somebody might get on the MoCA or MMSE that have to do with safety and decision making capacity. So, we'll talk about that in the next slide. So requesting an MMSE or a MoCA can give you a baseline of your cognitive function if you're concerned about your memory and thinking. It can also quickly assess specific cognitive domains of memory and thinking that you might be having trouble with. So, what are those cognitive domains? So, orientation is one of those. So, that's where we assess awareness of time, place, and person. And I'm like asking what day it is. Do you know where you are? Are you getting lost outside of your neighborhood? Those are types of questions for orientation. We also do registration and recall. So this is short-term memory and long-term memory for other tests that aren't as quick as the MMSE or the MoCA. But this will ask you to remember a few words or possibly a story and retell it later. These tests also look at attention and calculation in regards to memory and thinking. So the ability to perform simple calculations like serial subtractions. One of them asks to subtract 100 by 7 or subtract 20 by 3s. They do digit spans front and back to see how you can process and how quickly you process things. Language is also included. So this is going to look at can you recall naming objects and the ability to follow commands? Are you understanding what's being said to you? There's also visual spatial abilities. So you're thinking, or excuse me, you're seeing, you're visual. And these can be addressed in things like copying a design and a test. So please note if someone shows clinical decline on a mini mental status exam or a Montreal cognitive assessment, a referral to a neurologist who specializes in memory and thinking should be made. A neurologist can use imaging like a PET scan, MRI, and blood work to delineate what type of dementia a person has and how that dementia can be clinically treated. We'll get into driving a little bit more, but I do just want to highlight on this slide. This is the practice parameter update. This was by the Academy of Neurology. They got together with a bunch of actuaries, and what they did was they looked at driving accidents and a person's memory and thinking testing. And while it uses other things like how concerned a loved one is about their driving, how often they drive, do they not go on the interstate anymore, do they not drive at night, it also looks at the score of the MMSE, the Mini Mental Status Exam. And if somebody has a score of 24 or below, they recommend that they no longer drive. That is, it's not safe for them on the road or for other people out there on the road. And we'll get into that a little bit later in this talk. But just an overview on what people can tell or what clinicians can tell on the testing that is available. So I wanted to talk a little bit more, and this is just a quick slide about kind of activities of daily living. So activities of daily living are things like taking out the trash, throwing out spoiled food if it smells bad, being able to pay bills, to walk the dog as necessary, just things like that. And if you look at this is the MMSE score. I should say we all start at 30. Somebody that gets a 30 on their MMSE score has no cognitive deficits at all. So if somebody gets a 25, they might start having trouble taking their medications or keeping an appointment or maybe using their smartphone. That's a really big one. A lot of people have trouble using new technology. We have a technology slide as well that I'll talk about. But so these are just some things for you. And as Hazel said, she's going to send out the slide so you'll be able to have all of this information. So let's really get into the nitty-gritty of safety and how that relates to Alzheimer's disease. Because Alzheimer's disease causes a number of changes in the brain and body, it affects safety. And depending on the stage of the disease, it depends on how intense, if you will, that safety might be affected. So it affects judgment, maybe forgetting how to use household appliances, sense of time and place, getting lost on one's own street or in one's outside of the neighborhood, physical ability, having trouble with balance. It affects senses, so we can experience vision change. People with Alzheimer's disease towards the later stage can most often get what we call tunnel vision, so they don't have any perception of what's happening outside of their direct line of sight. They can also their pain registers differently. So if something is burning them, they might not understand that. Depth perception, and there's a slide about depth perception. They don't know when one thing begins and one ends. And behavior, and this is a really big one. So becoming easily confused, becoming suspicious or fearful can often happen. Now, I would like to say in regards to this, just because one person with Alzheimer's disease doesn't mean that everyone is going to have those same effects of the disease. While a lot of these behaviors and safety concerns are common, not everyone is going to have them. It is, however, important to be aware of safety needs, as this will help prevent injuries and assist in the person with dementia to feel more relaxed and less overwhelmed in their own space or spaces they're familiar with. So judgment and decision making. In Alzheimer's disease, the neurons lose connections as amyloid plaques and tau tangles accumulate, and this does affect their ability to make decisions and their judgment. So a couple of safety tips: set the hot water heater to 120 degrees. You can put red tape or fingernail polish on hot water faucets so they'll have a visual cue that what's coming out of that faucet is hot. Monitor use of the oven and stove. This is specifically in the moderate to late stages of the disease. You can remove the knobs on the stove, unplug the appliances, They also think about garbage disposals, removing that. You want to monitor finances. If you don't have a durable power of attorney with your loved one, I strongly suggest you get that, and we can talk about that more after the presentation. But you want to gain access to their checking, savings accounts, and other financial documents that they have. If someone's having trouble maybe spending too much, they don't remember that they went to McDonald's, so they went to McDonald's, 4 times that day. We had a patient who was a regular at the McDonald's on Harrodsburg Road. And what happened was she started for paying for everyone at the McDonald's. It wasn't financial exploitation. The people at McDonald's didn't know that she had a memory or thinking problem, but all of a sudden her daughter started to notice large amounts of money being taken out of the account charged to McDonald's. We still wanted her to keep her independence as much as possible. So the daughter just got her a prepaid debit card with $10, $15 on it. Once that was out, she couldn't take any more out. So those were some things that you can do to help somebody be independent, but also keep them safe. And we'll talk about scams in another slide. That's a really big one as well. Firearms. In the state of Kentucky, you really can't take away anyone's firearms based on their memory and thinking abilities. It is their constitutional right to have one. So you want to make sure, if they're adamant about having it, that you keep it locked. You keep ammunition locked in a separate place from them. There's also some information at the end of this PowerPoint that talks about firearm safety from the Alzheimer's Association, if you want to look at that. Lock up or put above the refrigerator sharp objects. This is particularly if somebody is having some behaviors in regards to safety. Maybe put the knives in the drawer and have a secure lock on the drawer so it's difficult to open. You also want to think about power tools, lawnmowers, and outdoor grills. Limit access to pools or hot tubs, or be with them when they're out. I think some hot tubs you can have a lock on the cover that goes over it. If your loved one is starting to need help with medication and medication management, store medication in a locked cabinet and remove expired prescriptions. This is especially important if somebody you love is on a heart medication. Also, reduce or discontinue alcohol intake and supervised drinking. You don't want to completely stop alcohol intake, as this can be a medical emergency. So definitely talk to your loved one's primary care physician if you're thinking about trying to reduce the amount of alcohol they take. If somebody's a smoker, I'm trying to help the person either stop or cut back. Just be careful with matches and lighters, specifically if they smoke at bedtime or in the bed. You want to watch out for that as well. So I know we talked just a little bit about safety in the kitchen. This is some things that you can do for the stove. Lots of times, if you have a warning sign, it's a visual cue for somebody that they shouldn't go near there. I know when I see a caution sign or a warning sign, I get a little bit more alert and understand that that's not something that I should be messing with. We'll talk about wandering in the next couple of slides, but I did want to just kind of mention this. So they make really great wallpaper these days that can camouflage a door. If there's a basement door that you don't want someone to go into, this is something that you might think of. You can order them online. So safety and scams. Oh my goodness. We have heard it all quite literally. I want to tell you there are mail scams. So people will mail your loved one things saying they need their help with something, or they need to donate this much money, or this or that will be canceled. But we've had people walk up, knock on the door and say, I got all your bushes trimmed and your grass mowed. That's going to be $1,000. And the participant went to their, emergency stash, paid the person on site, no questions asked, They never did anything. Phone scams and email scams. So they really do hit you at every point possible. So, and I believe Hazel has written an article in regards to scams that's in the chat. If you want to look at that, that'll give you some information and tips as well. But have conversations, particularly if somebody is in mild cognitive impairment or the early stage of Alzheimer's disease. Have those conversations about scams, about what they might say, monitor financial accounts, speak with banking institutions to see if they're able to put any safeguards into place and maybe highlight monitoring uh, the person's bank account and calling you directly if you have power of attorneys or durable power of attorney. And encourage them never to let someone have access over their phone or their computer. We have a nurse practitioner here who was scammed. It was an Amazon scam. It was over the phone. She gave them full access to the computer. I know for UK, we've got team viewers. IT helps me a lot with team viewers, but I've called them, encourage them. If you haven't called them and they're telling you that your computer's at risk for virus or something has been compromised, ask them to call back. Typically, the scammers will tell you that you've won a prize or that you have a problem. There's also an unexplainable urgency. They don't want them to hang up. They don't want them to think rationally. They'll require payment in specific ways like gift cards or MoneyGrams. And on the slide here, you see some different things that you can do. If you have a landline, or say if you have a landline at your loved one's house, maybe turn off the cell phone ringer so they don't even hear it. For mail scams, you can use a PO box. For smartphones, they have a lot of different apps you can look at. They're named here. Doorbells and ring cameras for scammers that might come knock on the door. And whatever phone provider you use, maybe call and check if they can have call-based blocking. I know I've got an iPhone and it'll say scam likely when somebody calls that is most likely a scammer. Let me just say that these people are so intelligent in what they do. Even if somebody answers a phone number that they call, that's what they call a live number, and they can then sell that number to other scammers. So it's just it's difficult and it requires action on everyone's part. The Office of Attorney General's number is there. They have information on their websites as well as what new scams are coming out. I know one of them is a grandparent scam where they'll say the grandchild is in trouble and they don't want to call the parents. That's a really popular one too. All right, so let's talk about time and place, and we'll get into a little bit more of driving safety, but any sign of wandering or being unaware of someone's surroundings, even just once, if a person has been diagnosed with dementia or mild cognitive impairment, is something to be concerned about. So again, Alzheimer's is a progressive disease, and due to this progression, most people, not all, but most will become unfamiliar with their surroundings to some degree. When you notice a decline in concentration or orientation, it's important to observe your loved one's abilities and modify routines as you need. This can include keeping a large calendar or a whiteboard in the kitchen or living room, one of the main rooms you're in most of the time. You can tell them what's happening, if they've got doctor's appointments, if there's a family party or occasion that's happening, different things like that. Giving them cues about what's going to happen, like saying it's almost lunchtime, so they can just kind of start mentally preparing, oh, I'm going to get up and go into the kitchen and have some food. Using labels or pictures on cabinets to help your loved one. One of the things is dishes. So let me pause for a second. I apologize. It's really important to try to keep your loved one as independent as possible. So if you notice that they're putting the dishes away and it's not in the correct place, having a label that says glasses or having a picture of the glasses on the cabinet can really help keep their independence and keep both of you from looking where things might end up in different places in the kitchen. You can also use voice activated timers or reminders like an Echo or Alexa for medication reminders. Um, and reaching out to other caregivers and support groups, medical providers, and social workers. And the next slide talks a little bit more about wandering. So thinking about activities to combat wandering, you want to utilize community organizations for dementia-friendly events. Lexington is a dementia-friendly, has dementia-friendly Lexington, which if they've gone through the training, they will have, we are dementia-friendly certified. Um, I know Ramsey's is one of those. Lots of other different places. I think Ramsey's might have been the first restaurant, which is why that comes to mind right now. There's also Memory Cafe, Best Friends program. Become regulars at a favorite restaurant and develop rapport with staff. Um, this is opportunities for your loved one to be engaged because sometimes restlessness or boredom might be cause for wandering, which is why we're talking about it. Also check your local senior center or your YMCA class for programs that might be available to provide exercise, again, more activities. So in regards to safety and thinking about safety, you want to keep the doors locked. Consider a keyed deadbolt or add another lock placed high up or low down that person might not be able to get to. Due to potential hazards that could cause, if there's an emergency, if these are locked, make sure a caregiver who knows how to use them is present. Don't lock these things and then leave your loved one alone. You can use loosely fitting doorknob covers as well, so that the covers, you kind of have to have a little bit more of a grip to turn them. Again, those, if you remember the previous picture of the stove, if you place stop or do not enter or closed signs on the doors that you can get at hardware stores, that might be helpful as well. Let's see, the wallpaper door decor that I had mentioned earlier. And you can also purchase items at hardware stores that only let windows open up to a certain amount. A chime system, like a door alarm, it can be a magnetic one you can get off Amazon. It can be one that's installed by, a security company, but it's kind of that announcing chime. So maybe if you're in the bathroom and you hear that, oh, that door shouldn't be open, something's going on, and you can check it out quickly. You also want to make sure the yard is secure with fencing and a locked gate. Sometimes if somebody who has tendency to wander sees things like keys, suitcases, hats, or coats, they might then kind of trigger that, oh, I need to get out. I need to go to work. I need to go do something. So trying to keep those out of sight is helpful. Also, keeping an extra key around and letting neighbors know. I know it's very personal disclosing if somebody has an Alzheimer's diagnosis or not, but particularly in that moderate stage or towards the end of the moderate stage, if wandering does become a problem, you want to tell your neighbors, and we can talk a little bit more about that within the technology portion of this and how to keep everybody on the same page. Okay, so driving concerns. This is a really big one. So if people have trouble locating familiar places or trouble following directions to find new places, I know everybody has a GPS monitoring device, but if your loved one now can't plug in the address they're going into that monitoring device, that can be a problem. If they're driving too slow or too fast, or they get confused while driving, and you kind of have to be the person that says, oh no, you want to make a right here, or oh, that's a stop sign coming up. Poor lane control, defensive driving. Sometimes we see people with Alzheimer's disease who used to not be an agitated driver get very agitated and angry while driving. Look for possible fender benders, popped tires, just little things. They might have hit a concrete barrier and not known it. So, how do you approach driving concerns with your loved one with memory and thinking? First and foremost, you always want to start out with a conversation. Um, I think we need to talk about driving. It's really hard to have, but it's really the safest thing that you can do. Um, co- Talk to their physician or their neurologist about the conversations. I know we have family meetings a lot here in regards to driving. Um, how do I stop the driving? So remove keys or file down the key. I know some people, where are my keys? Some people can get anxious or upset about keys, not having their keys. So take off the car key and put on a different key that might be the same, or file down the car key. I know we all have key fobs now, so take the battery out so they're not able to get into the car. Um, and so a lot of times what we'll do is have our physicians write on a prescription pad. I know I've not seen a prescription pad in a long time, but they'll write on a prescription pad, you are unable to drive until your next appointment. And we have caregivers put that on the refrigerator. So if somebody's getting agitated or upset, they can point to that and say, Dr. Jica said we got to wait and see if the medicine you're on is helping, and then we can talk about driving. Um, Disable the car, take the battery out. They also have driving evaluations. I know Cardinal Hill has one now, and so does UK, or what UK is part of Cardinal Hill. So they do driving evaluations. Well, they'll take them out on the road as well as do simulations. There are alternatives to driving, and I can talk about those afterwards if you'd like. Um, there we go. Okay. So physical abilities in regards to safety. And thinking about physical abilities and safety, we look at fall risks. Um, I think it's if you're 65 and over and you break your hip, you have about a 50% chance of a fatality of not coming out of the hospital from that broken hip. So this is really, really important, even just for older adults. Looking at the stair rail, you want to ensure handrails aren't loose or broken. If you can, have them on both sides of the stairs, so the left and the right, and make sure they are the entire length up the stairs. Never place objects on the stairwells like a laundry basket, something that needs to go upstairs. I am at fault with this. My son's church shoes are on our stairs right now that I'm thinking about this. But really, we want to keep those spots as clear as we possibly can. Ensure the steps aren't loose or broken. So sometimes we have that one creaky step, get that fixed. It's a fall risk. Have a light switch at the top and bottom of the stairs. Um, you want to check the carpet to ensure the carpet, in any rooms, not just the stairs, are attached. And then if it's not carpet, get some of that non-slip rubber treads that you can put down. Inspect things within the home that people can easily trip on, like a throw rug, clutter, stacks of newspapers, electric cords, telephone cords, things like that. Keep walkways clear of any item that isn't securely in place. If you're walking around furniture to get to where you're going, that's a sign that it needs to be moved, and it can be a fall risk. Also, clean up spills quickly. Any wet flooring, things like that. A dog might tinkle on the kitchen floor, or the ice machine. I know sometimes our ice machine will leak if we've got it kind of in the hopper, if you will. Clean that up. And then really lighting is so important. It is so hard to walk if you can't see. Evaluate lighting in the hallways and stairwells. Ask for someone who you know who might have a little bit more physical ability to get up on that tall ladder to change that light out. Fluorescent lights are the brightest and they do use the least electricities. Have a lamp on the bed that's easy to touch, maybe one of those tap lamps that you tap and turn on. And motion activated night lights truly are hip savers, I like to say. If you can put motion activated night lights in the bedroom and in the hallway and in bathrooms, that'll help as well. In regards to fall risks, you want to make sure shoes are fitting appropriately and that clothing isn't loose and big. We actually our feet can shrink in older age, so you just want to make sure that somebody's not slipping or sliding out of their shoe. Also, house shoes or socks with grippers on them are really good as well. If there have been a series of falls or a very bad fall, home health referrals I advocate for. So home health can come in and do an assessment. Occupational therapy can come in and do a safety assessment, tell you maybe where to put that grab bar, where to make sure that that light is installed, maybe move from carpeting to hardwood floor, laminate floor. But home health referrals have to be made by a clinician, and the person has to be seen in office in order for the home health referral to be made. And we can talk about that a little bit more afterwards. But I want to talk about bathroom safety and just give you all some ideas and tips and tricks. So this having kind of a handheld shower and a shower chair is really, really good for safety in the bathroom. Non-slip mats are really good. Toilet safety, having a lift on the toilet with those grab bars to make sure someone's steady. I know blood pressure can get really low sometimes with older people who are sitting and go from standing. So you want to think about decreased physical ability in the shower. Would a shower chair be helpful? Installing handheld shower heads or grab bars. Again, if you've got a shower glass door, maybe removing that and a just a shower curtain that's plastic, because if somebody does fall into plastic, they're going to hurt themselves a lot less than if they fall into glass. All right. So now let's talk about senses. Alzheimer's can affect every part of your ability to interpret the world around you. In sight, there might not be wrong physically with your eyes. You can get them checked at the ophthalmologist. However, the brain's ability to interpret images may be decreased. This can cause confusion and disorientation and the inability for people to recognize familiar places or people. So a few tips, and I'll show you on the other side. You want to create a color contrast between floors and walls. Actually, I'll just show you now and come back to that slide. But if you've got a white toilet or a white bathtub with a white wall, you see in this one, it's kind of hard to differentiate, where you can put up that peel and stick wallpaper, or they've got those the sticky things that are used for bathtubs. You can put them on the side so that people can get a sense of depth perception and reduce falls and be more independent. If they can see the toilet, maybe they won't need as much help toileting. Smells in regards to senses, look for spoiled foods, look for foods in strange places. I had a lady have her ham in the pantry back in the day when it was a country ham cured. That might have been safe, but it's not safe now. Taste, people lose a lot of taste, so this can affect if the person eats. People with Alzheimer's disease tend to gravitate towards sweet things or salty things. If you find your loved one isn't eating and is losing weight, you might want to encourage them to eat nuts or maybe salty nuts. That might be more of something that they enjoy. Also, there's danger or confusion as placing hazardous items in their mouth. Some recommendations would be lock up cleaning supplies, consider learning the Heimlich maneuver in case of emergency. In regards to hearing, as in the case of the eyes, a person could have tests and have perfect hearing, but not be able to process sounds. This can lead to agitation or confusion, also overstimulation. So you should avoid excessive noise in the home. And if you're in a large gathering of people, particularly maybe around the holiday time, or if you're celebrating a birthday, if there's a quieter space that your loved one can go to, they'll be able to interact more and understand what's going on and be less anxious or scared or wonder, which is a worrisome behavior. Touch, as with all other senses, the sensitivity of touch decreases. So depending on how severe the loss is, a person with Alzheimer's disease might not be able again to recognize hot or cold or bad food. So we talked about depth perception and what that can look like. I want to spend some time on behavioral and psychological symptoms of dementia because this absolutely involves safety. So it's important to remember that someone with Alzheimer's disease is unable to reason the way that you and I can. The reality they create to make sense of everything that's going on is not flexible. So think about not trying to explain it away or explain to them. For instance, there was a woman who said it wasn't her house. This isn't my house. I'm not home. She would get very agitated and angry with her family members about this. Her family members got the will out of the lockbox at the bank, or not the will, the deed, took it to her. She said, "You've made this up. This isn't true." So a lot of times people with Alzheimer's disease and their thinking aren't flexible. They're not able to understand when you provide explanations about things. So in thinking about pain, you want to think about a UTI, maybe somebody's constipated. If this is the case, maybe keep a log of when they have toileted. Look at the urine, if there's blood in it, if it smells, make sure they're hydrated. People with Alzheimer's disease often forget to drink water or drink in general. So it's really important safety wise that they stay hydrated. So feelings of abandonment, a theme that we often hear is they want to go home, and they might be in the home that they've lived in for the past 40 years. When someone says they want to go home, it's really not they want to go to their physical home. It's a place, that kind of comfort of being safe. So again, just verbally reassuring them that they're safe, that they're taken care of is really important and can help those feelings or those distressors that might cause them to be unsafe. So some behaviors, while frustrating to the caregiver, can be soothing to a person with memory and thinking. So if you have a loved one that maybe hums mm, over and over, while it can be incredibly annoying, it gives them a sense of security. This is more towards the late stage of the disease. This isn't something that you're typically seeing in the earlier moderate stages. But remember, this is due to the disease. It's not a decision they're actively making to get back at you, to punish you, to frustrate you. This is a disease. So speak calmly and be aware of your facial expressions and body language. Listen to their concerns. Try to avoid arguing or reasoning with them again. Offer reassurance that they're here, that you're here. Some people ask for their parents who have died long ago. Let them know that they know that they're safe. And we can talk a little bit more if that is a problem with someone here. We'll talk a little bit more about that. But you want to also explain what you're doing. before touching the person with dementia or starting a new activity, such as bathing. So if you're bathing, helping someone bathe, I'm putting soap on the washcloth and I'm going to put it on your arm. Do you want to take it from there? See if they'll take it from there. Um, Also show that you understand if they seem upset or if they're having any of these behaviors. And just ask them, you seem really worried. What's going on? Sometimes just them being able to verbally express it and then hear you comfort them will really help. Um, Take a lot of breaths, count to 10. Caregiver stress is real, and we can have a whole nother presentation about that. There's also some information about a caregiver workshop later on within the slides that Hazel will also email out, which really talks about caregiver and caregiver stress. Excuse me. All right. Oh, there we go. So this is my last slide. It's about using technology to keep you safe. Make sure someone carries some type of ID with them or wears a medical bracelet. If they use a smartphone, activate Find My Phone or Life 360 so that you know where they are. You can look at your phone and know exactly where they are. Let neighbors and local police know. Those apps that I had talked about, there's group messaging apps. That you can use if somebody sees them out, maybe just even in a group text thread. Hey, I saw your mom a couple of houses down. That way, everybody can help and pitch in. Place labels on garments to aid in identification. Keep an article of the person's clothing unwashed in a plastic bag in case they've gone for a walk and the police need to use dogs to try to rescue. Keep a recent photograph of your loved one as well. Using technology like Echo and Alexa, they have technology that can pre-program phone numbers. It's not to be used in place of 911, but it does help. These can also help remind you of medication reminders, to-do lists, shopping lists, things like that, if they're in the earlier stage of Alzheimer's disease and just need a little bit of help, those devices can really help. So medical alert systems, this right here has come a long way. It's not just a necklace. You can wear watches as well, or it can be in-home monitoring. There are costs for that, but there are lots of different options. If you just Google medical alert systems, let's see. And then Ring video monitoring is not just for outside, it can be used inside as well. This might be a little bit scary, but if your loved one has fallen in the kitchen and you see that, you can talk to them through the monitoring system and alert the authorities as needed. The group chat that I talked about, there's a thing called Nextdoor and WhatsApp if you're comfortable telling your neighbors. If you're worried about the stove, you can use electronic tea kettles. And this is an automated pill dispenser that they have. It beeps to let the person know they need to take the medication. And some of them have smart technology that will send you a text saying the medication wasn't opened at the time it needed to be opened. So then you could give them a call and let them know. So I know we're a little bit out of time. I just want to go through these as resources. This is different types of dementia that you can look at when the slides are provided. This is just home safety checklist to help with your home. This is a great information sheet to manage agitation and aggression provided by the NIH. And there's links to all of these in these slides. Again, communication can help with safety because it's so hard for people to understand the reality they live in versus the reality you and I might live in. And this is not in the slide resource, but I think Hazel's going to do me a solid and send it out to you all. This is the Dementia Caregiver Workshop. This really talks about how to focus on you, home communication strategies, and caregiver stress, and resources available within the community. Firearm safety, it can be the hardest thing. So just some information from the Alzheimer's Association about firearm safety. All right. So that is the end. I'm going to stop sharing.